So during this pandemic, many patients affected with this COVID. After that, some of the patients landed up into the Mucor Mycosis. So these patients, Mucor Mycosis, some of them demanded for these jaw resections. Jaw resections. Okay, for these patients, their oral disability. So we have seen such cases. So they're suffering with swallowing. They're suffering with the chewing. They're suffering with speech, and they're suffering with the disfigurement. Okay, such patients we wanted to give a functional fixed prosthesis. So the total idea is to rehabilitate them with whatever the last structures. Okay, by restoring that, they'll regain their functionality like speech, chewing ability, swallowing, and all these aesthetics also. So thereby patient also social life and their function is restored. If you see this patient, so all the bone resected, like this is a cheekbone, part of cheekbone, part of nasal bone and palate, some of this alveolus bone, it's all resected. So now the oral cavity and the nasal cavity are in communication now. Whatever patient drinks or not start chewing, it will go to the nasal cavity. It will come through the nose. This is a very regurgitation, what we call. So that is a very difficult thing for the patient, and such patients who are not able to chew, and those poor patients they cannot speak also, because most of our the sounds will produce it through this palate. So now because we have already removed this palatal bone and all, there is a speech disability as well. And of course, because we have removed the cheekbone and all, there is also facial disfigurement. So there such patients we are rehabilitating at Medicover with all state of the art equipment and materials. So surgical, see, already those patients already were hospitalized for months together. So we have reduced the hospitalization time for one day for surgical thing, and next day they can discharge. After that, after 2 weeks of post surgically, we'll start rehabilitating these patients with the tooth and lost structures. With the advent of these kind of acrylic and PEEK materials, we rehabilitate entirely. It's a lifelong, because since where we are placing these implants are very strong bone, so they are not going to resolve in few years. Okay, so we hope that it will stay for lifelong. See, patient to patient it differs, because these implants are specific to patient, each and everything. Okay, so approximately 3 to 4 lakhs it will take.